as a small business owner, it's been a particularly challenging time for us. Like all other businesses, our customer base has declined dramatically in the past few weeks. That was largely to do with decisions that I made early on for the good of our community and for the patients that we serve, to close our office to inpatient visits. I did that about a week earlier than most other providers did, because I felt that it was the right thing to do. And I felt it was very important to show some leadership on this topic and set the standard that we could expect from other providers. And most every other provider in the state has followed suit with the termination or suspension of non-essential in-person visits. That being said, the needs of our patients didn't suddenly stop that day. We have many patients with chronic and acute illnesses that require ongoing attention. And so it's absolutely necessary that businesses like ours keep our doors open, virtually or otherwise, so that we can meet the needs of our communities. And so as a provider who's been doing telehealth, telestroke for many years, it was relatively easy for us to convert to a purely virtual environment. So all of my employees are working from home. All of our clinic visits are done using the Zoom licenses generously provided by the State Department of Health that make it easy for us to adapt our practices to be virtual practices. And we're really actually finding it to be a tremendous experience for us and for our patients. Most routine healthcare can be readily delivered virtually. A lot of, at least what I do as a neurologist, doesn't require a hands-on visit. And our patients are uniformly very appreciative of our ability to continue to take care of them. And even more, very, very happy that we're able to deliver high quality healthcare in their homes so they don't have to interrupt their daily activities. This is a new feature that was enabled by the wonderful and appropriate liberation of some of the restrictions on how healthcare is delivered by our federal government that I really, really strongly supported, and very happy that it made it easier for us to continue to deliver needed care during this difficult time. That being said, we can't see enough patients this way to keep our doors open. And so we definitely availed ourselves and need the support from federal and state governments in order to keep these services going. All of us who do healthcare rely on in-person procedures in order to generate the revenue that's necessary to keep our businesses going. So programs like the Paycheck Protection Program and the direct support to healthcare providers and hospitals have been absolutely critical to keeping our doors open during this time. It definitely bought us some time. I think practices like mine will probably be fine for another month or two with that level of support, but it will be important for us to find ways to get back to some sort of regular business in that time frame in order to keep things going, or we're going to need more support, which hopefully that's not the direction we have to go. But I think a lot of practices like mine are looking into the not too distant future and are pretty worried about how things are going to turn out. So I am very understanding of the people who want to get back to work, the people whose businesses are suffering. I'm right there with them. But at the same time, I wear what I consider a really important hat and carry a moral responsibility to reflect the public health needs of our communities and try to help people understand what could happen, not necessarily what will happen, but what could happen if we back off from the needed restrictions that are in place now. And I really want to very strongly applaud and support our governor, who I think has made really, really tremendous decisions that are obviously really hard for him, really challenging. There's a lot of pressure coming from both sides, including from me and my colleagues, asking for more restrictive limitations on movement than he was comfortable with or felt able to do. I still feel like our job is to advise and try to give the best advice based on the data as we understand it. But we also understand that it's up to the governor to make these hard choices, and we support the efforts that he's made. And I think that there's pretty good evidence that the decisions he's made have been good for the people of Wyoming.
What's helpful even about that guesstimate is knowing that there are a lot of Wyoming physicians that are at risk of having their practices permanently compromised if this thing extends too long. And the fact that the Paycheck Protection and other federal programs are available to private practice physicians is allowing for the extension of medical service in Wyoming in many communities, not only now, but in the future. That is a fair statement, correct?
I 100% agree with what you just said.
Okay.
One extra bit I would add to this is that a number of physicians who would describe themselves as employed live in smaller communities, and they're employed by their local critical access hospitals, some of which we know are in significant financial difficulty. And so their employment is also on the line for exactly the same reasons, that the inability to do routine, better paying procedures in those hospitals is dramatically affecting their bottom lines, and so their ability to continue to employ the doctors that work for them may be in jeopardy. That could also extend to some of the bigger hospitals in the state that employ large numbers of physicians, where we're already seeing some scaling back of work hours and salaries for some of the employed providers and other administrators of those facilities. And so it's creeping up to involve a broader swath of the healthcare industry in the state. But I think you're 100% right that the solo practitioners and the small groups and the smaller communities, and then the small specialty groups like mine, even in the larger communities, are the ones that are most at risk for early failure if things don't start to turn around.
Does this just exacerbate the problems that were associated with our status as a frontier state?
Yeah, I think the answer to that is a really complex one with a lot of moving parts to it.
Yeah.
So a couple things that come to mind when you ask the question that way are is that for both routine and emergency care in a lot of places in the state, there may only be one provider or maybe two providers able to deliver that service. And so if they fail because of economic challenges, or if that provider gets sick or God forbid dies because of COVID, it would have a very detrimental effect to healthcare delivery in that area. And then, of course, because of our geography and our economics, many of our critical access hospitals are running on super thin margins under normal circumstances, and now don't have the ability to exist for very long in negative revenue states. And so the failure of even just a few of those critical access hospitals will be extremely detrimental to our population, because people already travel much farther than anywhere else in the country to get needed healthcare, and that will only exacerbate the problem if we lose any of those organizations. So those are a couple of problems that jump to my mind right away. And then, of course, many other aspects of our economy are tumbling for reasons that we're all well aware of. And our dependence on energy revenue is clearly having a dramatic impact, and is going to just undercut all of that really fragile stability that we built over the years anyway. And so I worry, of course, about healthcare providers, but also about the communities that they serve, and permanently losing jobs and insurance and access to nearby healthcare is going to have really, really bad effects on the overall well-being of our population, which will cause the incidence of chronic illness and disease like heart disease and brain disease and diabetes and obesity. We know that these things will skyrocket in places where the population becomes poor or is in an economically depressed state.